I know I said last time that intros are hard, and I stand by that. I don't know why I struggle so much. Anyway, hi, hello, welcome to today's video. If you're new here, my name's Emily. I am currently almost 39 weeks pregnant. I'm 38 weeks and 5 days. It is currently April 15th, so I am 9 days out from my due date. I think I said previously, I can't tell if it's wishful thinking that I'm going to deliver her before my due date or if I really feel like that, but I still really would like to not make it to my due date. I'm feeling a little uncomfortable, which we'll get into in a minute. Before I just dive in, don't forget to like this video, leave me a comment, subscribe. If you haven't subscribed already, it would mean so much. I know it's like literally the tiniest number ever, but I passed 300 subscribers, so I thought that was pretty cool. And I just wanted to say thank you to anyone who has subscribed or tunes in to these videos. It really means a lot, and I just have a lot of fun doing these. So, all right, I won't ramble on too much longer. Let's get into my 39 week update. Also, sorry, I probably look a little disheveled. I tried my best to kind of get it together, but I just got home from the gym and I'm just hot all the time. So I'm sorry, and I'm out of breath always, so excuse. Here's what's been going on lately. So I see my midwives every week, once a week. Feels like I literally live there. But the time before last, my blood pressure was actually pretty high, which I kind of knew it was. I just had a feeling that going in that was gonna be a topic, and it was kind of scary, I'm not gonna lie, because if I haven't said it already, like I really do not want to be induced. I don't know, I just have no interest in that process. I would really like to not go down that route. I know it can be really hard on a woman's body, and it's just like this cycle of Pitocin and yada yada, and I just like really don't want to do that. So blood pressure was something I was definitely nervous about. So when my midwife said like, oh, that's looking pretty high, like let's get some blood work, I instantly was like, I'm getting induced. Like that's it, I'm getting an induction and that's that. And I just already was starting to kind of spiral. But externally I was like, okay, yeah, blood work, like no problem. Like, yeah, totally, I'm sure it's fine. And she was super sweet about it. She was like, I'm not too concerned. I think you're fine. Could just be like an off reading, but just to be safe, let's get some blood work done. We'll check all of that. So that was a very nerve-wracking 24 hours. That was at my 37 week appointment. So that was like a couple weeks ago. So I was very nervous, got the blood work done. The next day it came back. She, you know, messaged me through like my patient portal thing and was like, good news, like you're all good. Just take it easy. I asked her if I can still work out. She said yes, like keep doing what you're doing. Just monitor your blood pressure at home if you can and try to be mindful. So I was like, okay, I can do that. So then this last appointment, my 38 week appointment, I went in and we were good. She was like, I'll take it. Still higher than I personally would like for it to be, but it was low enough for her to be like, I'm comfortable with that. Like, you're doing good, keep it up. Like, we're good. So I was very happy to hear that, because like I said, that's been like one of my fears, one of my like concerns. So I was very happy to hear that we were good to go. Okay, it's the same day I am editing this video right now. I also forgot to mention that at my 36 week appointment, they did my GBS test, group B strep test, and it came back negative. So we're all good with the GBS. Thought I'd throw that in there because I totally forgot. And then I also had my second cervical check and I was 1 centimeter dilated, which when I got checked at 36 weeks, I was not dilated at all. So it is very reassuring to see that like my body's making progress. Things are happening like they're supposed to. It really doesn't mean anything as far as like when labor is to come. Like you could literally be a centimeter dilated for like a month and it means nothing. The hardest part about the last couple weeks is just that like, oh, well, you could go into labor at 3 a.m. or in 3 weeks. Like that is torturous, but I'm really trying to be patient and not think about it so much. And I feel like I've done a pretty good job. It's just, man, at nighttime you start getting uncomfortable and you're like, okay, is tonight gonna be the night? Like, let's get it going. But obviously nothing so far. I've definitely been experiencing like pelvic discomfort, cramping, like super low cramping, and my midwife said it's most likely like the effacement that's happening. So it's like when your cervix is thinning out, it can kind of come with like that cramping. So I'm assuming that's what it is. Don't really know. I did dilate a centimeter, so I'm sure it has something to do with it, but it just feels like she's getting lower and lower and it's just shifting all that pressure down, and I feel it. Yeah, I do. But as far as like mucus plug, bloody show, like I feel like, and this is TMI, but if you're watching this, like I feel like at this point at 38, 39 weeks, you should be expecting to hear some of these topics. And I do intend on filming like when I go into labor and all of that. So it's just gonna get worse. So if this grosses you out, I'm not sure how the next few videos are gonna go for you. Just fair warning, I'm gonna be talking about all the nasty stuff. So any men in my family, be forewarned. Be forewarned. Here's a fair warning. Oh my god, whatever, you know what I mean. But I do feel like I lost a little bit of like the mucus plug. I don't know though, things are weird when you're pregnant. Like I've talked in the past, one of like the main symptoms and like annoyances is how leaky I am. Like it's just irritating. Like I'm fully wearing liners every day because it's a lot. And I've been looking into it a lot more because I was just so curious about like the mucus plug. I asked some of my friends like, did they lose theirs? Because that's the thing, is you can literally lose your mucus plug like a month before you give birth, or you could literally never lose your mucus plug. That's a tongue twister. I just said it like 10 times. But that's like just such a weird concept to me. And I also thought, so I've been looking into it a lot, and I also thought that like your mucus plug was something that just like sat at the bottom, like right at your cervix. But I guess that's not the case. It's, and I'm not an expert, but it's like all of your like discharge and like lining and mucus, it starts to fall. And then once so much collects, like gravity kind of happens and like you could lose like a chunk of it. Apparently, I don't know, that's what some doctor on YouTube said, but it's just hard to tell because there's so much happening down there anyway. So I feel like at some point it all kind of blends together. I don't know. Pregnancy is just weird. But yeah, but no like bleeding or anything like that, nothing major. It kind of feels like someone kicked me in my vagina sometimes, like if I've been sitting for too long, especially if I'm sitting like straight up and down, all that pressure is just sitting like right there, super low. So when I go to stand up, it's just like, I don't know, sometimes it's really uncomfortable and sometimes I'm totally fine, but definitely like my tailbone and my vagine have been quite sore. I'm still seeing my chiropractor once a week. I'm literally obsessed with her. She's like the coolest person ever, but my adjustments have actually been going really well. So she's like, it's like the Webster technique. It's for like prenatal visits. So it's just a much like gentler adjustment. Like, you know, we're not twisting and doing all the crazy stuff. It's just very much about like pelvic alignment your back being supported and all that good stuff. So it's very gentle, but I've been going. She is super encouraging. She like lets me know like, oh yeah, baby's super low, like everything's looking really good. Like she always is saying like, I'm so proud of you for staying so active, because I have been like low-key killing it in the gym lately. I don't know why. I just got this like burst of motivation to just stay very active. And that was actually one piece of advice that my chiropractor gave me. She was like, just try to keep your stamina up. Like the second that you call it quits, like it's very hard to get back to that point. So quite literally every single day I get at least half an hour of some kind of movement in. Sometimes it's literally just on the treadmill, sometimes it's at the gym lifting, sometimes it's 30 minutes of taking my dogs for a walk. Like just no matter what it is, having at least 30 minutes of like intentional movement just for myself, that doesn't include like housework and all that, I feel like has really helped me, and I've really enjoyed that. So I'm going to keep doing that as long as possible. I was literally at the gym today, like I said, and actually I met literally the sweetest girl ever in the locker room. I was taking pictures and she busted me and I got like super embarrassed, and I was like, I'm just like really pregnant and I'm just like trying to document all of like, you know, until I give birth. And she was like, oh my God, you look amazing. She's like, how far along are you? And I was like, you know, I'm doing just a little bit over a week. And she was like, oh my God, you're amazing for being here. Like, you look so beautiful. And I think I said I love you. I'm really sorry if you're watching this. I don't get out of the house much and you were really nice. So I'm very sorry for saying I love you, but I kind of mean it. So it's just so nice to meet like a nice girl at the gym who's like super encouraging and motivating, and she was literally just so sweet. So I really appreciated it, and it honestly made me feel like $1 million. I was like, oh my God, I am amazing. Like I'm at the gym and I'm almost 39 weeks pregnant. Like I'm freaking killing it. Oh, but another thing that has definitely been like a buzzkill is like carpal tunnel. I have fully gone from being like, oh, my wrist kind of hurt, to like, I have carpal tunnel. Like my mom said she had carpal tunnel when she was pregnant with me. So I guess this is like karma, but oh my God, it hurts. Like it definitely sucks. And like I'm okay right now, like I'm doing fine, but at nighttime it's rough. It started out only in my right hand and it only hurt at nighttime, and then it moved to like kind of being sore throughout the day, and then both of my hands started hurting at night, and then they both started hurting throughout the day as well. And now, like, I noticed yesterday or the night before that in the middle of the night it hurt to like close my hand, and it's fine right now. Actually, I feel like honestly working out helps, like kind of getting that blood flow and like getting that circulation for sure. It helps, I think, but it's becoming more and more prevalent in my day, like just how sore they are. And yeah, like I said, at nighttime, like you're getting up to pee 6 times a night and rolling out of bed without like your wrist to support you, or like wiping without your wrist. Like it just, it's a little bit hard. It's a little bit challenging, but they're actually doing okay right now. So maybe I'm a liar. She is still like just such an active baby. It is wild. Like I've never once done any form of like kick counting because she's so active that I'm like, within 5 minutes, after like 7 o'clock, within 5 minutes I've already gotten my 10 like kick counting. Like I don't know if that's normal. My mom said that both me and my sister were like very active babies, so maybe it is like a genetic thing, I don't know. But like, dang, she moves a lot. And just real quick, I know I was saying like I've been really consistent with like the gym and movement and all of that, but I've also had some days where like that is literally the only activity that I get, and then I'm like down for the count, like just exhausted. I just go and lay down in bed, and then all of a sudden like 3 hours are gone and I wake up and I'm like, whoa. So I've definitely had a few days here and there where like there is no getting anything done, and I just totally let myself have that. I don't feel guilty about it. I don't apologize for it. Like, I am just 100% listening to my body, and on the days that my body wants to be productive, I continue to nest, and on the days where I'm exhausted, I take the hint and I check out. And I'm also not gonna lie, I'm always like, okay, but what if I went into labor tonight? Like, I need to rest. My body's telling me to rest. Like, what if tonight is the night I need to be rested? So that's kind of like my motivation behind like not feeling guilty about it, because I'm like, what if my body's like preparing to go into labor? Which one of these times is gonna be true, and I just hope that I'm rested. And I'm still having like insane dreams, wild dreams, vivid dreams, random, like so random and real. It is so bizarre, and I've had a few dreams about going into labor, and they've all been positive, thank goodness. But I can tell it's definitely in the forefront of my mind. But yeah, the dreams are crazy, and like I said, I'm getting up like 6 times a night to pee, and I just go boom right back into my dreams. So yeah. And honestly, even with like the dreams, the carpal tunnel, being limited to like left side or right side sleeping, I have been sleeping super well. Like, I sleep hard. So I'm very grateful for that, because I know like insomnia is very common in the 3rd trimester. So I'm really, really, really happy that that has not happened to me, because oh my God, I really love my sleep. And I know newborn life is right around the corner, so I'm like really enjoying my sleep. And then last thing I have like written in my notes is that I installed my car seat yesterday. So it was like a nice cool day outside. If you don't know, I live in Phoenix. It's already starting to get hot, but we've had such a beautiful week this week. Like, the weather has been perfect. I mean, it's been like 75 every day, like really cool mornings, cool nights. It's been beautiful. So I took advantage of that and put the car base in yesterday, and I got like her little mirror set up and did a little test run to make sure like I can see her, and it's just very exciting. If you didn't watch my last video, it was a what's in my hospital bag video, and then I've already added like a couple of things since then. So I actually put my boppy pillow, like my breastfeeding pillow, in like the bag that it came in, and I put it in my car, and I figured if anything, like maybe I won't take it up at first, but if after I give birth, if I'm like, okay, I really like these hospital pillows are not doing it, I need like a real pillow, then I'll send Sean down to the car and he can get my boppy pillow. But if not, then it'll just stay in the car, and obviously we'll bring it in when we get home. But I did put my boppy in the car so that it's just in there ready to go, one less thing to like think of day of. I also added a beach towel just in case for the ride to the hospital. If I'm like, if my water breaks or something like that, I want something to be sitting on. And then also for the ride home, just in case, because, you know, bleeding and all that stuff. So just to be safe, I feel like a beach towel is probably a smart thing to have in my car. And then also I'm bringing an ice chest, because we are going to be encapsulating my placenta, so I need something to bring that home in. She said that they will package it and put it on ice for us, but to bring a cooler. So I have a cooler in my car ready to go. We'll see how that goes. There will be, I'm sure, a whole video on that. Oh, and then as far as like food and everything goes, I've never had any like weird cravings. They're just kind of like random, but I just wanted like a Cobb salad. Not like a healthy, good for you salad, but like a Cobb salad with like romaine lettuce and like a hard-boiled egg and cheese and bacon bits and ranch and croutons and sunflower seeds. Just like a good old like salad bar salad. That has just been so nice. I think I've literally had like 10 Cobb salads in the last like week or two. So that's been very nice. And then still just any kind of sweets. I just love sweets. So as far as food, that's it. My appetite is super hit or miss. Sometimes I'm like ravenously hungry, and sometimes like the thought of eating totally turns my stomach and I just have like no interest, especially like once it gets later in the night. Like I know some women are big like nighttime snackers. I am not. At nighttime, I'm like, ugh, I don't want any food. I'm good. Like if we wait too long to eat dinner, like I'm just probably not gonna eat very much because my body is just like done. I would say around 3 o'clock is when I'm like ready to snack. I've been trying to be good, but I don't know how well I've been doing at that. But you know what? We're almost at the end. I'm not being hard on myself. I'm just enjoying these last few weeks. Honestly, that's really all I have. This video hopefully will be a little bit shorter than my usual videos. I am really good at rambling on, so I'm trying not to do that. But I did just want to give one last update because I feel like this could be the last one. I honestly don't know. It's weird because I'm going to go grocery shopping this weekend, and in my head I'm like, is this gonna be like my last grocery shop? Like it could be, could not be, but it could be. And that is just very exciting. So who knows? The next video you see could be like my labor vlog, could be another update, could be a nesting video. I have no idea. But with that being said, that's really all I have for today's video. I hope you guys enjoyed my 39 week update. Just very excited to meet our baby. We talk about it all the time. Both of us are like ready to get the show on the road. Let's do it. Like enough anticipation already, but practicing my patience. All right, guys, thank you so much for being here and watching this video. Like I said, don't forget to give it a like, subscribe if you haven't subscribed already, and I'll see you guys in the next one. Bye.